You guys need to see this.
So unfortunately, last month I was diagnosed with breast cancer. I have said no to chemo, radiation, and surgery.
Why?
Instead, I am doing some alternative treatments. So I wanted to
no.
share with you some of the things that I am currently doing. To be very careful about how I say things. I'm going to use like some code words. I'm not telling anybody that they should do any of these things. So starting off strong, I want to talk about some repurposed candies that I'm currently taking. I do get these two specifically from an online pharmacy. So for the two candies I get through the online pharmacy, one of them is a combination. It has eye candy and M
Ivermectin?
candy in it. And then the other one is just the eye candy because I needed to increase the dose of the eye candy that I take. The eye candy you can get on like Amazon or at like your local like Tractor Supply, Fleet Farm. Pretty much anywhere that you can get candy for your livestock, you'll be able to find the eye candy there. Typically what you're gonna find at stores like that is gonna be a paste.
I'm not gonna talk about this creator specifically because everyone is entitled to their own cancer journey, but I am gonna talk about the medications that she's taking and why it may not be the best options if you have breast cancer. And just to give you a little background on diagnosis, what she has shared is that she has triple positive breast cancer, which means that the cancer cells have receptors for estrogen, progesterone, and HER2. And then she said on the right side, she has a stage 2 invasive ductal carcinoma, which is spread to 3 lymph nodes. And then on the left side, there's a stage 1 non-invasive tumor. And so given this diagnosis, there are actually effective targeted treatments that she can do, which I'm sure every oncologist is screaming through their phone right now. And so first-line treatment for her would be chemotherapy plus a HER2 targeted therapy, because the chemotherapy is going to kill the rapidly dividing cancer cells, and the HER2 targeted therapy specifically targets the HER2 protein on the cancer. And then after may come surgery and radiation if it's needed, and then long-term hormone blocking therapy, which these treatments are proven to reduce recurrences and save lives. Honestly scares me that she's trying to treat her breast cancer with ivermectin and mebendazole, because the only data we've seen has been in lab dishes and mice, but there hasn't been any studies to show that there has been real help in patients. And choosing it over proven cancer therapy treatments is really dangerous. This is why it's so important to work with oncologists who you trust and to not rely on your own research when it comes to your health.